Just a few months ago, waiting lists at the Whittington hospital were growing, but they've now been dramatically cut after staff ran extra clinics to see more patients.
We did some late evenings, a lot of late evenings, but the weekends were, I think, the changing factor. We were open for 8 weeks, 8 weekends, Saturdays and Sundays, and seeing over 1,000 patients every weekend.
And that really made the difference?
And it really did make a difference.
The government says at least 65% of patients should receive treatment within 18 weeks. At the Whittington, they're now doing even better.
In December, only around half of patients here were receiving treatment within 18 weeks of a referral. Now that's almost 3/4, and more than 6,000 patients have been removed from the waiting list here since the start of the year.
But that's life, you know.
Philip has chronic back pain and is thankful he didn't have to wait too long to be seen.
Yeah, we know there's large queues, you know, so you expect to wait 6 months to break in.
How long did you have to wait?
About 6 months generally. The staff are great.
Latest NHS figures show more than 66% of Londoners are now waiting less than 18 weeks for treatment, the highest level since 2022. And nearly 80% of patients are now seen within 4 hours at A&E, the highest level in almost 5 years. At the Whittington, extra funding to pay for staff helped tackle the backlog, but that might not always work.
It's not really sustainable just to throw money at the problem. And what we've got to do is, as well as using sprints to take away a sort of hump in demand, we've probably also got to change the way we look after people and become more productive.
Not all hospitals in London are meeting their targets, but in most, waiting lists are now coming down. The question is, will it last? Leyla Hayes, BBC London.